Good morning, everybody. Thank you for joining us today for DC Village's community conversation looking at Medicare open enrollment. Um, we put these on periodically and we'll put the recordings up on our YouTube channel. Afterwards, I'll drop a link to that in the chat so you can look up the previous sessions that we've done. Today, we are very pleased to have here with us Darnetta Banscomb, who's the lead project director for the Senior Medicare Patrol in DC, which is a program of the Legal Counsel for the Elderly. And we, going to get right into things right away. So I'm going to hand it over to you, Ms. Banscomb, please.
Thank you so much. It is a pleasure to be here, and I appreciate this opportunity to provide this content to the DC Villages. We'd like to say good morning to everyone. In today's presentation, we'll talk about Medicare open enrollment and other services. Now, on the next slide, we'll review the agenda. So we'll talk about who we are and our mission, Medicare fraud, errors, and abuse. Who can I contact if I have questions? Scam alert. What is Medicare open enrollment? Savings with extra help, and legal counsel for the elderly services. On this slide is our mission, and we are Senior Medicare Patrol. We empower and assist Medicare and Medicaid beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do this through outreach, counseling, and education. S&Ps are grant-funded projects of the federal U.S. Department of Health and Human Services and the U.S. Administration for Community Living. Our work is done in main areas. We conduct outreach and education, we engage volunteers, and we receive beneficiary complaints. On next slide, we'll look at Medicare fraud, errors, and abuse. Now, if I was in person, I would ask how many Medicare beneficiaries do we have in the audience? But we're going to move on to, what is Medicare fraud, errors, and abuse? The Medicare fraud occurs when individuals or providers intentionally bill Medicare for services that were either not received or billed at a higher unjustified rate. Providers may commit Medicare fraud by billing for services, supplies, or equipment that were never provided, or by offering medically unnecessary treatment. And those unnecessary treatments could be lab work, x-rays. Those can be considered unnecessary treatments. You might be wondering why Medicare fraud matters. Well, it has a significant impact on everyone. Each year, Medicare loses billions of taxpayer dollars due to improper claims. This is not only jeopardizes the Medicare Trust Fund, but also affects the future of the Medicare program. Additionally, Medicare fraud, errors, and abuse directly impact current Medicare beneficiaries by leading them to higher premium. It also wastes funds that could otherwise be used to enhance and expand healthcare services. Next, we're going to review what you can do if you suspect a provider is committing Medicare fraud or abuse. Now, on this slide, we're going to look at what you should do if you suspect Medicare fraud, errors, or abuse. We want you to contact the DC Senior Medicare Patrol. And our program is a national program. We're located in all 50 states, territories, including District of Columbia, Puerto Rico, U.S. Virgin Islands, and Guam. For the DC Senior Medicare Patrol, we help you prevent Medicare fraud and report fraud or attempted fraud to other authorities, such as the Office of Inspector General. And the number for DC Senior Medicare Patrol is 202-434-2099. I'll repeat that number. The DC Senior Medicare Patrol hotline number is 202-434-2099. Now we're going to move on to our latest scam alert, and we received this from the Office of Inspector General. So scammers are targeting individuals by spreading false information about how to receive the Social Security Administration annual cost of living adjustment, It's the COLA for 2025. If you're a beneficiary expecting an increase, there's no need for action on your behalf. The adjustment is automatic. Social Security Administration has announced a 2.5% COLA increase, which will be reflected in benefits starting January 2025. Notifications will be mailed out in December, and those with online accounts can view their COLA increase there. Now we're going to review Medicare Open Enrollment. What is Medicare Open Enrollment? Medicare Open Enrollment, also known as the annual election period or Fall Open Enrollment, runs from October 15th through December 7th each year. What changes can you make during that time? During this time, you can make specific changes to your health insurance coverage, including adding, dropping, or changing your Medicare Advantage and Part D coverage. Even if you're happy with your current health and drug coverage, open enrollment is an excellent time to review what you have now, compare it with other options, and ensure that your current coverage meets the needs for the coming year. You can make many changes as you need for your Medicare coverage during open enrollment. Changes you can make include joining a new Medicare Advantage plan, joining a new Part D prescription drug plan, switching from original Medicare to a Medicare Advantage plan, switching from Medicare Advantage plan to original Medicare. Now, I would like to add that during the Medicare Open Enrollment period, it's the time to review your prescription drugs. Each year, Part D prescription drug plans create a formulary, and they decide what drugs they'll cover in the upcoming year. It could be possible that your drugs may not be on your current Part D prescription drug plan's formula for 2025. And if that's the case, this is the time that you would make a choice, review your prescription drugs, and contact the current Part D drug plan to ask them, are you currently or will you be covering my drugs in the upcoming year? If they say no, then this is the time for you to choose a new Part D plan. Now, if you have original Medicare, that means you have Part A as your hospital insurance and Part B is your medical insurance. You would definitely pick up a Part D plan. If you are new Medicare beneficiary, you have 3 months prior to your 65th birthday and 3 months after your 65th birthday to enroll into Medicare. They give you a 7-month window, the 3 months prior, your actual birthday year, and the 3 months after. That's if you have been invited to join Medicare. That means you have the 40 quarters, or you've been disabled for 24 consecutive months, or you have Lou Gehrig's disease. Those are the 3 ways you can be invited to enroll into Medicare. And if you don't meet those 3 requirements, then you can purchase Medicare out of pocket. Now, if you are switching from the original Medicare we talked about, Part A, Part B, and you're going over to one of the Medicare Advantage plans, and they're considered all-inclusive because by law, Center for Medicare and Medicaid Services, the Medicare Advantage plans must come with Part A, hospital insurance, Part B, your medical insurance, and other services. That's why they call them the Medicare Advantage plan, because they come with many advantages over original Medicare. The Medicare Advantage plan can also come with transportation. They cover vision, they cover dental, which the original Medicare does not cover. So original Medicare does not cover vision, it does not cover dental. Now, we'll make exception to cover vision if you've had the cataracts surgery and your physician prescribes glasses or contacts for you. They'll cover it in that aspect. but you will not pick up a Part D plan because that's one of the advantages of having a Medicare Advantage plan. You'll have your Part A, your hospital insurance, Part B, your medical insurance, and you'll have your prescription drug all rolled into one. And also, as I stated before, you may have transportation, vision coverage, and dental coverage. So just want to be clear on that. That's what you can do during the Medicare open enrollment period. Switch out of your original Medicare and your Part D plan, roll over into a Medicare Advantage plan, all inclusive, or vice versa. And it's always good to check with your Part D prescription drug plan to ensure they're covering your drugs going into 2025. Okay. On our next slide, we're going to look at how to save some money here. We're going to talk about Extra Help. So this is one of the Medicare savings programs. It's called Extra Help. And you may be eligible if you meet all these conditions. If you live in one of the states or the District of Columbia, your annual income is below $22,590 for an individual or $30,660 for a married couple. Your resources are below $17,220 for an individual. A married couple resources should be below $34,360 for a married couple. Resources include money, checking, savings, or retirement accounts, stocks and bonds. Resources don't include your home, personal items, one car, burial plots, up to $1,500 for burial expenses if you put that money aside. It does not cover furniture and the household and personal items. Now, how does Extra Help work? You need Medicare drug coverage to use Extra Help, meaning you would be enrolled in a Medicare Part D drug plan. Once you qualify for Extra Help, Medicare will enroll you in the drug plan where you'll pay $0 for your premium and deductible. You can choose another drug plan, but you may pay more if your plan doesn't offer a $0 premium and deductible for people with Extra Help. Now, I know you're wondering, how do you apply? You might qualify automatically for Extra Help, but if you don't, it's easy. You contact the Social Security Administration. You can reach them online at ssa.gov/extra help. Again, that's ssa.gov/extra help. Or you can call Social Security at 1-800-772-1213. ETY users can call 1-800-325-0778. After you apply, Social Security will send you a letter to determine whether you qualify. To learn more, visit medicare.gov/extra help or call Medicare at 1-800-MEDICARE, and the number is 1-800-633-4227. Now, on our next slide, I'm going to share some information about the Legal Counsel for the Elderly. Along with housing the Senior Medicare Patrol, Legal Counsel for the Elderly is a free legal and social work service DC seniors 60 years and older. Now, Legal Counsel for the Elderly is a grant-funded program, and their grant tells them to assist DC residents only. But if you live outside of the District of Columbia, you can still give them a call because we've taken the time to research other legal services that are comparable to ours in all the states. So if, for example, if you live in Maryland and you say, I live in PG County, we have a log that will give us an attorney in Maryland, specifically PG County, that will provide services that are comparable to ours. So please don't hesitate to contact the Legal Counsel for the Elderly. Now, all are welcome to contact the Legal Counsel for the Elderly, and their number is 202-434-2120. I'll repeat that number, Legal Counsel for the Elderly, 202-434-2120. They provide free legal advice, assistance, and referrals for senior civil issues. Now, another unit in Legal Counsel for the Elderly is the DC Office of the Long-Term Care Ombudsman. Now, Legal Counsel for the Elderly also houses the Office of the DC Long-Term Care Ombudsman. The Office of the DC Long-Term Care Ombudsman advocates for residents of nursing homes, assisted living facilities, community resident facilities, and residents in private homes who receive home health aid through the DC Medicaid waiver program to resolve complaints for an individual resident and a group of residents. They are also on the front line advocating for legislative changes to improve the residents' quality of care and life. Now, to contact the DC Long-Term Care Ombudsman Office, their number is 202-434-2190. I'll repeat that number. The DC Long-Term Care Ombudsman Office, 202-434-2190. Now, this completes my presentation for today, and I am available for question and answer. Thank you so much.
Yeah, if anyone has any questions, you can either put into the chat or unmute yourself and feel free to ask. Okay, there was a question. During open enrollment, you can change between traditional Medicare and Medicare Advantage, but I've heard there are some challenges when going from Medicare Advantage to traditional Medicare. Are there any restrictions or anything to know before making choices?
There aren't any restrictions that I know of. The Health Insurance Counseling Project is the specialty on helping beneficiaries make those changes. I'm not aware of any restrictions. If you're already enrolled in your original Medicare, then you've met the qualifications. And then if you want to switch over to a Medicare Advantage plan, that would just take a conversation with the Health Insurance Counseling Project, and just to ensure that the Medicare Advantage plan is in your area. You want to ask the question of what's the cost of the premium. I would ask them about customer service. I would also ask them about the prescription drugs, if you're taking prescription drugs, if they're covered under that plan. But that just takes a conversation. I'm not aware of any restrictions per se.
What about the other way around, coming from Medicare Advantage to traditional Medicare?
Coming from a Medicare Advantage plan over to traditional Medicare,
Correct.
It would be the same course. If a person is in a Medicare Advantage plan, that means you've met the requirements to enroll in Medicare. They're all governed by the Center for Medicare and Medicaid Services. It's just an extension of additional services. So there aren't any restrictions going from a Medicare Advantage plan over to original Medicare.
Okay. We're getting several questions in here real quickly. What if you're well past your 65th birthday and have not enrolled yet?
Okay, if you're well past your 65th birthday and if the person received an invitation to join Medicare and they did not, that person will suffer a 10% penalty for the duration of their Medicare life once they decide to enroll.
Wow.
Now, there could be some situations that prevented them from enrolling when they were invited. And those are case-by-case basis. And for one example I know of, there was a person who was incarcerated during the time of where they could have Medicare open enrollment. But CMS has created a new special enrollment period for persons that are coming from incarceration. So they're not hit with that penalty once they have the opportunity to join Medicare. And there are some situations and case by cases where they can omit that penalty for a person, but that would have to be discussed with Medicare.
Is that Good morning, and thank you so much for your presentation. Is that penalty to your premium or to your coverage?
It's to your premium.
And this may sound like a silly question, but do we pay for Medicare?
Yes, you do. The premium going into 2025, the premium is $184, I think 20 cents. Most people do pay a premium. Some pay more. The premiums, that's the general premium, $184, I think, and 20 cents going into 2025. But there are situations where some beneficiaries pay $0 because they're considered low income and they qualify for Medicare and Medicaid. Medicaid is a state-run health insurance, and combined Medicare and Medicaid is considered QMB, qualified Medicare beneficiary. And if you're a qualified Medicare beneficiary, then you don't pay. You pay $0 for your premium. You pay $0 for office visits. Medicare and Medicaid cover your entire health care bill, I would say. So there are situations where some people don't pay for Medicare. And then, I should have mentioned that there are instances where people pay more than the announced premium because they use the previous 2-year adjusted gross income to calculate what a person's premium will be. That's if you're not low income.
Right.
I applied for Medicare and did not realize that there was a premium. So I have not been paying my premium. Have I been dropped from Medicare?
How long has this been going?
A little over 2 years.
So that means you don't have Medicare.
So do I
We'll drop
reapply?
you.
Would I reapply?
Yes, you would have to contact Medicare and they would have to approve you to join.
So there's a chance I might not be eligible.
Well, there is a chance that they may not accept you into Medicare.
Oh my
But there's a
gosh.
conversation. You can call Medicare and explain to them, what you just said, that you didn't realize there was a premium associated. What are you here in the District of Columbia?
I am.
Okay. So if you're here, let's see, I'm going to take a little time just to get the Health Insurance Counseling Project phone number, because you can call them and explain to them what you just said. And it's either going to, once you contact Medicare and explain that to them, they're going to reply to you via mail to let you know if they're accepting you into Medicare. And if that's the case, you may be hit with a 10% penalty.
Right.
So that may, for some, it could be a deterrent. Do you currently have health insurance?
No.
Okay. Because I was going to say, if you had health insurance, then that could be maybe a justification, along with not being aware of the premium, is that you had health insurance. So you didn't, want to go through and join Medicare. Sometimes that is a way to alleviate the penalty. If you have health insurance, or if you're on your spouse's health insurance, you can alleviate the penalty as long as you had some coverage during that time period.
Okay.
Is that
Yeah.
the DACL health insurance counseling?
Yes.
Okay.
Yes.
All right. I've got the phone number and the URL for it. I'm putting that into the chat now.
Thank you so much.
Yeah. Thank you. You've been all been very helpful.
Oh, you're welcome. Yes. If you have other questions, my information is in the chat area, but I can give it out aloud. We have a hotline number. I'll just repeat that. The number is 202-434-2099. If your question is not answered today, please call the hotline. We answer that hotline personally between myself and our administrative associate, Lillian McGilvery, and we have a 24-hour turnaround time.
There is a comment in the chat that asking if Paula realizes the premium is deducted from Social Security monthly payments. She may have been paying it without realizing.
That's yes. So if you are receiving Social Security retirement, that premium is deducted from your Social Security.
Thank you. That
So
unfortunately is not the case, but
Okay.
thank you.
yes, ma'am. Thank you.
Someone else asked, why would one change to a Medicare Advantage plan?
Well, because they come with many advantages, opposed to original Medicare. Medicare Advantage plan, they come with coverage of dental, vision, transportation. Sometimes they give you a catalog to order some of the over-the-counter supplies. Some of the Medicare Advantage plans, they give you a debit card for fresh fruits and groceries. I think it's about $106 a month that you can spend, but it does not carry over to the next month. So those are some of the advantages. And it also gives you your Medicare Part A, your hospital insurance, and your Medicare Part B, your medical insurance. So it has many advantages over original Medicare. But also keep in mind, if you are not low income going into a Medicare Advantage plan, it could be at a higher premium for you. But if you're willing to pay that higher premium, because you're going to have all these additional advantages over original Medicare, then, that's the plan for you. But you would definitely call the DC Health Insurance Assistance Program to get that information. They can tell you the Medicare Advantage plans in your area, the cost associated, and they can also tell you if your prescription drugs will be covered. So you'll get all that information in the forefront before you make your decision. Now, Medicare Open Enrollment ends on December 7th. But after that, we do have some special enrollment periods.
Okay. Is there any way a person with an Advantage plan can buy insurance to help with the copay, or is that just available to original Medicare?
Yeah. You mean, are they talking about the gap insurance?
Might be. There's also a question about Medigap policies.
Okay, so the Medigap policies are not available to people or beneficiaries of Medicare Advantage plans.
Okay.
They're available to people with original Medicare. And I don't know of, and that question was about a policy that will help cover copays.
Yeah, the first question was if you can buy insurance to help with the 20% copay on an Advantage plan. And then the second question was if you don't buy Medigap within the first 6 months, is it still possible, or how much more expensive is it to get Medigap coverage? So two different.
Could I explain? I think those are two quite different questions.
Mm-hmm.
So I have an Advantage plan, and it has been paying 80% of eye injections for macular degeneration, which are horribly expensive. And then there are some nonprofit organizations that will pick up the 20%. But it's possible to reach a point where your income doesn't entitle you to that nonprofit support. And so then you're looking at, let's say you need a $6,000 injection every month. So 6 times 12, you're looking at 72,000, 20% of $72,000. So my question is there any kind of insurance that you could buy to help with that 20%, or do you just pay it yourself?
I will call the Health Insurance Counseling Project to ask that question of them.
Okay.
I don't know of because that's just not my specialty. My specialty is to help beneficiaries to prevent, detect, and report healthcare fraud. And I refer yes, ma'am, I refer to the Health Insurance Counseling Project, and they would definitely have that information for you.
Okay, that's great to know.
Yes, ma'am.
Okay, thank you.
And thank you for the explanation. That was really good. Thank you.
There was also the question, do you have to spend down your savings to qualify for extra help?
Well, there are other spend down would help qualify. Yeah, spend down would help qualify for extra help. And I think, let me see. When we talked about extra help, so let's see. So your annual income should be below $22,590 for an individual, or below $30,660 for a married couple. And that's how you will qualify for the extra help program. Let's see, they also include money in your checking and savings or retirement accounts. So it's more than just the savings account. They look at the checking account, savings account, retirement account, stocks, and bonds. Now, what they don't include is your personal items, your one car, burial plot. They don't include, money that you've just set aside, furniture or other household and personal items.
I have a
Anita,
question.
you have a hand up.
I have a question. I understand that Medicare Advantage, that you are limited as to the doctors who will accept it.
So was that the question?
Yes. Are you limited as to the doctors?
Yes. So it's you stay in network. You would stay in network, and if you go outside of the network, then that's a referral from your plan. And that's the same for Medicare. You would definitely see Medicare physicians that are accepting Medicare. And if you have the Medicare Advantage plan, then you have an in-network circle that you would utilize for your physicians.
Is there a way to see the list of doctors on your who are accepting Medicare Advantage before switching?
Yes, what you would do is contact the DC Health Insurance Assistance Program and explain to them you are thinking of enrolling in a Medicare Advantage plan, but you would like to see the list of physicians. And then you would, if you have the Medicare Advantage plan that you're thinking of enrolling, you can talk with your current primary care to see if they accept that insurance. If you don't want to have to, go through the trouble of switching out your primary care. But you can definitely call the DC Health Insurance, State Health Insurance Assistance Program and tell them that you want a list of the doctors and you want to ask them the questions, how's their customer service? What's the cost? Will they cover my drugs? Or if you have any other type of specialty doctors that you have to see for your health, you want to talk to them about that. Make sure all of those things are covered before you actually make your choice to make a switch.
And that is the DOCL Health Insurance Counseling number
Yes.
and link that was provided earlier.
Yes, that's it.
So that's 202-727-8370.
Yes, that's correct.
Okay. I have another question. It seems as though the Advantage programs are being promoted by various insurance companies. And we're getting many calls from various insurance companies and seeing a lot of ads on television. In making a decision of which insurance company or which medical advantage company to work with, it's a difficult decision. How do we get advice?
Okay, so what I have talked with my parents about is not choosing your health insurance from a television advertisement. The advertisements, and you may see some celebrities advertising some of the Medicare Advantage plans, but they're doing a job and they're not disclosing all of the pertinent information you need to make an informed decision. So I refer to the DC State Health Insurance Assistance Program in order to make your choice. And you have to find the Medicare Advantage plan that's offered in your state. And you have the time to ask them the questions, all the questions that you need to have answered before you make your decision. And when you look at the television advertisement, that's an open door for them to contact you. And with the Medicare Advantage plans and representatives, they have do's and don'ts. They have rules that they have to abide by. So a Medicare Advantage plan representative, they're not allowed to go door to door. They're not allowed to put advertisements on your car, in your mailbox, in your private apartment buildings. They're not allowed to make cold calls. They can't call you unless you've opened the door to call them. So that's what the advertisements are for. They show this advertisement, they put the number there, so then we call. Now you've just opened the door to be accosted by these Medicare Advantage plan representatives, because the more plans they sell, they get paid for that at any cost. It may not be the plan for you, but if you enroll, they're going to get paid regardless. So I would not use the television advertisement in any way to choose my health insurance. And even when you come where it talks about, I've seen advertisements about a knee brace, a back brace, an ankle brace. Those are durable medical equipment. You have to be seen by your physician. You have to be fitted for what you need for your health condition. And that's not going to come from a commercial. So if you need a durable medical equipment, you have to see your physician. He'll give you a prescription, and then he'll give you some advice on where to go to get that durable medical equipment, a knee brace, a back brace, a wheelchair, crutches. And the same for enrolling in your health insurance. Contact the DC State Health Insurance Assistance Program. That is their entire job, is to counsel people and current beneficiaries enrolled in health plans to help them inform decisions going into 2025. Now, in the event that you were duped and you enrolled into a Medicare Advantage plan, the cost is too much. They don't cover your prescription drugs. The facility is 30 miles away from your home, but you didn't have that information prior to enrolling. We can get you out of that, and then we'll enroll you into a plan that's fitting for you, or we can enroll you back into your original Medicare.
What you are indicating is that there are dozens of Medicare Advantage plans with different coverages.
Yes.
Is there a chart that compares them, that we can go online and see what each Advantage plan is offering?
I'm not sure if there's a chart online, but if there is, that's where you would get the information from the DC State Health Insurance Assistance Program. They can lead you to a website because they have all of the comparisons, and I'm sure they have a website that people can go to look at that.
Thank you.
And also, if you have the 2025 Medicare and You Handbook, if you're currently enrolled in Medicare, and you look in the back of that, that gives you the listings of the Medicare Advantage plans in the back of the book that are applicable to your state.
Thank you.
Yes, ma'am.
Is it correct that if you switch from Medicare Advantage to traditional Medicare, Medigap policies will not be the same rates as if you had started with traditional Medicare? Medicare gap policies will be priced taking pre-existing conditions into account. I think this is a disadvantage of switching from Advantage to traditional. Is that accurate?
That's a state health insurance assistance program question.
All right.
Yeah. Because I don't deal with the specific policies.
Got it.
Mhm.
Okay. I am not, I think we've covered all the questions that were in the chat. So I'm going to go ahead and say thank you so much, Ms. Banscomb. We really, really appreciate it. It's amazing the work you guys are doing, and your program is something people should definitely check out the link for more information that was provided. And if you do have additional questions or you think of something, please go ahead and email or call Ms. Banscomb. You can, if you click on the three little dots on the chat window, you can save the chat. So you've got the emails and phone numbers and stuff right there on your computer.
Thank you both. This was really very helpful, and thank you to the fellow participants for their great questions.
Yes. And thank
you
you so
so
much
much.
for having me today. Thank you so much for the opportunity.
Thank you.
Thank
Bye.
you.
Thank you. Bye.